So before we move on to capacity, anybody have any questions, comments about measurements? So we'll move on. Value stream capacity. How much time do we spend serving our patients? How much time do we spend on all the other non-productive activities? And then what's available? So remember, the idea is that this goes in lean practices and principles and methods will reduce this over time. You'll create the capacity. Then once you apply that capacity, you'll turn it into more productive capacity. That's the idea. This happens over time. It's not necessarily short term, but we want to continue to measure it to see the progress. I'm going to skip over this one. These are all in there. Because the point being that capacity and the use of the capacity could have an impact on costs or the overall profitability. Meaning, if we can see more patient, if we receive revenue based on services provided, if we can provide more services, we get more revenue. If we use the available capacity and redeploy it in the business, what you do is you hold your costs down. I don't like this term a lot, but there's a lot of cost avoidance. We're not adding costs. That's why if you look at costs, this is a very good measure. It's sort of like, it's a financial measure. It's not a leading indicator, but over time you should see like your labor cost as a percentage of revenue go down. Cost reduction. Well, no, it's a good lean indicator of, are we managing our costs? Because there's a big difference between cutting costs and reducing costs over time. And it's cost reduction. And most of the costs in healthcare are fixed, meaning they don't vary with just another, a true variable cost. I'm getting a little ahead of myself. That's okay. A true variable cost is we see one more patient, there are some costs. We see less patients, there's less cost. Most of the costs are fixed. Your labor is how much you're paying for capacity. Because those are the resources that do the work. And if you're freeing up those resources time, you're paying the same amount, but they're doing more because they're not performing the wasteful activities. So this is why this measure is very good. And so the box score, and when you see the capacity numbers, it sort of drives this type of thinking. And even from a strategic standpoint, you're making improvements, and as you make improvements, you always have to have a plan for the people. What are these people going to do? Now, if it's see more patients, that's fine. But, you know, do you move people around? If you get into the administrative areas, you have to have a plan. Because there's certain administrative tasks you don't want to do more of. And administrative people will quickly understand that it means less work. And so it's very, very important to speak a strategy that the people understand. People worry about it. I think if some people were quite honest, they would say, yeah, I do wasteful things. But they also know it keeps them busy. Because, you know, if you're in an office setting and you're not busy, you don't have work to do. But in a lean environment, it would be better to have people not busy if the waste is gone. So when you're looking at capacity in healthcare, you really have to look at the activities. And the activities that are primarily performed by doctors and nurses, because they're the ones who are primarily providing the value to the patients. And when we worked at the hospital, they had a very difficult time looking at activities and distinguishing. And so what we did is we came up with these 3 definitions. And it made it easier for people to understand and distinguish between what they do. A value-added activity is any activity that is required to assess, diagnose, and treat a patient or a resident care plan to the completion of that plan of care. Those are the value-added activities. What's interesting in healthcare, as opposed to some other industries, is there's a lot of what we call necessary waste. So it's non-value added but necessary. So it's not this, but it's an activity that cannot be eliminated based on either technology, policy, or thinking, current ways. We have to do this. You know, we have to file forms, we have to report certain information, we have to track patients. So regulatory, company mandate, or law. And what you find is there's a lot of those activities. Do your doctors have to provide the notes of their treatment? How do they do it? Just speak, write, type? Okay. So that's a big, you know, this is something that it came out when we were, so that's a necessary activity. You know, we have to have those records, right? I mean, does it move the care along? No, but we have to do it. That's an example. It's really interesting in this hospital, when we were talking about this, it came out that a lot of the doctors in this hospital, they would speak it and then somebody else would transcribe. They would do it on the way home in the car. Because they didn't feel like they had enough time. And my only point to it was it would be, you know, when would be the best time to do the notes? Right afterwards. You know, and I just sort of said, okay, I mean, I know doctors are very smart people, but if you see 15 patients in a day and then you're driving home, how do you actually remember everything from those 15 patients? And shouldn't they be given enough time between patient visits to make those, to put those notes in? Anyway, just, you know, it's a necessary activity. How do you minimize it, and when should it be performed? Then there is the pure waste. where it takes up resource time, and it's things like the waiting time and the rework and all the typical 8 wastes that you have in lean. So we want to eliminate this work, minimize this, emphasize that.
Our hardest time in the hospital is to, talk with people, is to explain pure waste, because always they see it as necessary to assess.
Yes.
I don't know why, but in hospitals, I think they've grown in the
Yeah.
culture.
It's not just in hospitals. When people have been doing something a long time, they begin to think that it is necessary. We have to do this. But until they learn what waste really is, it's hard for them to see it. And so that's why you have to teach them what waste is. And, it's easy to sit there and say, oh, that's waste. And I say, that's a wasteful activity. And you're like, oh, hold on. First of all, when it becomes personal. So this is why you talk about the process. And if you talk about the process and talk about what's value, and what's the outcome we want, and then what are the steps that get us there, and then you show that there's lots of things that are preventing it from happening faster, then people say, now I understand. So it's best to show them through that rather than talking individually. Yeah, it's in a non-manufacturing setting, the other thing you get many times is people like to do certain things their own way. That's sort of not, for patient care, the way you're supposed to treat a patient, I know there's protocols and standards, you can't really vary on that. But when it comes to other activities, there's a lot of, I do it my way, and I've been doing it my way for 10 years. My way, yeah, my way's the best. You get a lot of that. So again, it's a learning exercise. And always think about how, why is this person saying that? And just start a conversation and try to get in and reveal what's going on. So as you're looking at calculating capacity, you have to pay attention to these activities. Now, this is an example. We have a spreadsheet that can be used, and this is just a screenshot of the spreadsheet. If by some chance anybody would like a copy of it, I can get Freck a copy and he can send it out. But the idea is you look at, like this is the urgent care, and you look at the different roles, and you, right here and under task, you would list the different activities that typically go on, and you would calculate, how many go on, how many times does it occur during the month, how long does it take, and then this N or P actually is a drop-down screen, a drop-down where you select N for non-productive or P for productive, and then way down here, the spreadsheet does all the calculations and it'll calculate the capacity. So it just gives you an idea. What? Jesus, you want the spreadsheet? So it's a good tool to use. It's all set up. What I suggest, and there's plenty of rows, but remember it's a sort of a template. So if you start messing with too many of the rows and stuff, the equations, and don't ask me about the equations because I didn't create the spreadsheet, but I'll send you a copy of it. So to calculate capacity, probably what I learned in healthcare, in manufacturing, what we say is you get the capacity information from a value stream map. But the value stream, a value stream map shows the flow of the patient in healthcare, and it doesn't show the flow of the provider and the nurse. And so really, when you're looking at capacity, you want to look at the capacity of these people, because that's going to determine everything. It's going to tell you where the waste is. Because in a value stream map, if you have a healthcare value stream map, you see a lot of waiting time if you're looking at the patient. And the waiting time, the root cause of the patient waiting time is usually these people are doing something else. So that's where this is why you look at it from an activity standpoint. Yeah, we tried doing capacity from a value stream map. It didn't work, so we came up with this. So just remind me to send you this. So I'm going to skip over this. This is another way to gather data. And a good exercise to do just to get started is sort of to take this and look at a provider in one value stream. What are the typical activities that go on? What does the provider do? Is the activity value added, necessary, or pure waste? Just to get people thinking. It's just a simple exercise. Before you start talking about capacity and trying to calculate it, because again, you're trying to teach people, trying to make them aware, and so you want to bring them along at a certain pace. So I just put in about three sheets to do that. So take a few minutes and work on this. Okay, let's move on to the third component of the box score, which is the value stream income statement. In Lean, we talk a lot about flow. We have order flow, or how the patient's flowing, right? There's also information flow that has to flow at the same rate as the patient flow. There's also a third flow that gets talked about in Lean, and that's cash flow. And the idea behind the value stream income statement is to be able to measure the flow of money through the value stream. It may not be exactly cash. We're going to try to somewhat follow accounting practices, but it's the actual revenue, and then it's the actual costs incurred during that period. And we look at direct costs and we look at shared costs. I'm going to explain those in a few slides. Because the numbers that you use for financial reporting don't necessarily match up with that. Or what you might be doing today if you have reports that go into the functional areas is that they may have a lot of rates and allocations associated with it. We had a chuckle. And so we want to try to get away from that. The example I always give is that we want to try to make this, and don't laugh, because we want to try to make this as simple as the way we manage money. I mean, how much money do we have in the bank? How much money is coming in? We keep track of how much money is being spent, and we have money left over. We want to make it that simple inside the business. Because you remember the box score, we're trying to establish the relationships between capacity and performance and financial. And so we have to be looking at the real numbers for the period we're reviewing so that we can establish those relationships. Much like if a performance measurement doesn't mean anything in a lean organization, we don't want to use it. Likewise, we need to look at the change. We might have to change the way we look at our costs inside the business. Because a cost is an outcome, right? When you see a cost on a financial statement, it's an outcome of something. It's an outcome of what? A decision or the way we operate, right? So if you want to control costs, which are outcomes, you have to control what's creating the cost. So it's really about understanding how and why we make spending decisions. I even have, I think one of the sections in the book is it's not about spending, it's not about cost, it's about spending. People that are doing the work are the ones making the decisions on how money is spent by the way a process operates or decisions they make. That's where we want to get people thinking. We want to build financial awareness. If we do this, if we perform this action, it's costing us money. If we continue to do this wasteful activity, it's costing us money. That's the awareness we want to drive deep into the organization with a value stream income statement. That's why we only want to look at actual costs. So we're measuring value stream profitability. From a lean viewpoint, value streams are the profit centers of the business because you're flowing the patients through. If you flow the patients through and you get reimbursed by performing the services, then you're going to, that's the profit center. If you get reimbursed on a strict budget, that's a different issue. We are using actual direct costs. We want to minimize allocations. If we have to allocate some costs in to the income statement to understand profitability, and there are certain, I'll show you a few cases of when you might do this. We want to keep the allocation simple and easy. We're measuring the flow of money. We're seeking operational accuracy. Operational accuracy inside the business versus when we do our financial reporting, it's accuracy towards the accounting rules and regulations. There's a difference. Because non-financial people don't understand the accounting rules and regulations. And when you provide a non-financial person a financial statement that's based on that, they look at it and go, what does this mean? That's when accountants sit and explain everything, and they still don't understand what it means. What's an accrual? Why do we have to do this reserve? What's this? What's that? You did a journal entry. Why did you have to do a journal entry? So a value stream income statement is for internal use. We're trying to serve our customers. So it's just the format. All the numbers come out of the general ledger. It's just you create a format that's easy to understand by each value stream. And it looks like your typical income statement. So it's not, you can put as much detail on it as you want in terms of expenses. You could here, this company just did total operating expenses, but you could have like direct expenses and direct costs and shared costs. Again, format's up to you. You sort of want to follow the principles of this. Here's the principles to follow. You want to show the direct costs. A direct cost is, from an operational viewpoint, the value stream has sort of total control over that cost in terms of the way it operates or the decision. From a financial viewpoint, if you get you have to pay a bill, you have to pay something, you can take that and you can charge that to one value stream. Or you're looking at people, you can say, okay, this person works in this value stream. There's your direct costs. Shared costs, a resource or a consumption that is shared by more than one value stream. And the value stream can influence the cost, but really doesn't have a lot of control over it. So for example, like the hospital we worked at, they considered imaging a shared cost. But, imaging also does generate, in the US, imaging does generate a little bit of revenue, but it's also used by the emergency department and all these other areas. Then you have your business support costs, things like the cost of finance and human resources and your admin costs, and we don't put those into the value stream income statement. Your value stream direct costs, people, materials, drugs, supplies. Now, I realize some drugs, some supplies might be shared. I'm going to explain how you charge it into the value stream. The costs of the machines and equipment, and then there might be other. Anything else that can be made direct, it's fine to make it direct. People is pretty easy. You know where the people work. You have your value streams identified. And so all the people that work in the value stream get charged. You can do it through setting it up the way you set up your payroll, and then everything gets posted automatically. I have this in here because sometimes in some smaller companies, they don't like to, in the United States, they don't like, they don't necessarily share financial information. If you don't want to put the actual salaries of people in, you can just sort of put in a number based on the number of employees there compared to total salaries. Materials, we're looking at the actual cost of the material used. How do you do it? At which step can the material be specifically charged to a value stream? So if you're buying material or supplies or drugs and it's for one value stream only, charge it at that point. But if it's coming out of some common location where it's common supplies, then as it comes into the value stream, you want to charge it. Now, did you tell me about yesterday throwing away stuff? Yeah. Why don't you just share that? Because that was interesting.
So if patients' disposables have been in a patient room for 24 hours, after 24 hours we have to toss it because of hygiene rules. All disposable materials. And there's more examples like this, so it's not just patient room.
Yeah. So the way to so what's the lean way to reduce that cost?
Lower inventory.
Yeah.
As much as possible.
Well, the thing about supplies, is and I remember this from the hospital when we worked at it, I'm going to get this one supply, but you know what, since I'm here, I'm just going to get the other stuff too. That way I don't have to make another trip.
And we're not trying to do the turnover twice a day as opposed to once a day. So
Yeah.
we get the lower stocks.
Yeah, or what you have is, as opposed to a central location, you have locations in the areas with smaller quantities. Then they know they can pull, they don't have to go, they have shorter distance to move. Or you have the delivery. You have, there's lots of ways to sort of control it. Yes, the milk run. So we charge either at purchase or issuance. And we try to do it on an actual basis. We try not to do it in accounting and do it like, oh, well, we're just going to allocate this much, and this much in general. So even in manufacturing, trying to get to the actual material piece, that's something that sometimes requires some work. The people, pretty easy. Machines, which we're going to talk about next, pretty easy. Sometimes the material is hard because there's a lot of shared material. So machine cost, how much is the depreciation? How much in terms of maintenance, repairs, tooling, and anything else? Those are your basic direct costs. If you get people, machines, and materials, you're going to probably account for about 90% of the direct costs of any value stream. So again, if you don't worry about the other 10%. You got 90. The other 10% is not really going to move the needle any. The shared costs, like your facility costs, this actual building. Shared services, I mentioned that, like imaging, there might be some other shared services. And then there might be some support services. This is not administrative in nature, but are there, it's a shared service, but as opposed to an imaging machine, it might be people. I don't know if you have it or not, but you think this through. And facility costs get assigned based on space. Shared services can be assigned based on services provided. And support can be assigned by basically the number of people that typically work or support each value stream.
This is also a source for discussion.
Yes.
Which rule do you apply on your activity-based costing system? And you have all these big spreadsheets.
Well, yeah, and see, this is not activity-based costing. We're not trying to get to that level of detail. We're trying to create a simple method, because in the world of lean accounting, we don't want to use many shared costs, but we realize they exist. So what's the simplest, easiest way to assign that cost? And you start with, why are we assigning the cost? How often, and so if we're looking at financial statements once a month, we just need to assign the cost once a month.
You can't really change the cost of the amount in square feet of meters.
Well, right. Yeah. Some cases might. In a factory you can. I don't know about a hospital. Maybe, you never know. But that's okay. Again, you don't have to. Doing a value stream income statement, I always say, is an art, not a science. And, some companies, you might not even assign those in. You just say, we'll leave it at facilities, because it, like you said, it's not going to change. Shared services, maybe, assign in. But support, again, don't get into what's the driver of this activity, because it becomes, all these costs are fixed. And once you create a rate, you make it variable. And so again, that's why it's sort of like, just on average, how many people work if you're doing it? And just put that number in every month. Don't worry about, well, this month they worked more in this value stream than that value stream. Doesn't mean anything. And all of these costs are actually, they're direct. They're actually direct in that area. So the control is going to be in imaging, for example. You have direct costs in imaging, but when you're looking at sort of the profitability of a value stream, you just bring in a portion to understand. Let me get back to where I was. So, pick a value stream. Think about the costs that go into the value stream at this point, and which ones would be considered direct, which ones could be considered shared. Don't worry about how the shared cost is getting in there at that time. You know, what you have something right now, what should it be? Sort of think a little bit based on what we've talked about. All right, we'll move on. Go ahead and complete this in terms of looking at a value stream income statement. All right. So this exercise is about actually calculating a current state box score. And then after we calculate the current state box score, we're going to look at some improvements, calculate a future state box score. And everything's in here. The only thing you need is a calculator, which is on your phone, if you brought your phones, or you can use a computer if you want. And I'm going to go through the information. I do recommend that you work in teams, even like teams of 3 or 4. Split up the duties, and it goes a lot faster. You know, I'll calculate this, you calculate that, and all that. And then we'll review the answers. Okay. So this is a primary care value stream. We have 4,100 defects per month. We have a patient satisfaction score of 3.1 out of 5. We see 3,200 patients per month. The average length of stay is 60 minutes. Of that 60 minutes, 18 is spent with the nurse and the doctor. 42 minutes is spent waiting. Here's our employee information. And this information here in this first column is going to what you'll be using to calculate capacity. So we have 27 people. They work 8 hours a day, 20 days a month. And by the way, this right here is going to give you the total capacity. And 30% of the time is spent with patients. 20% of the time is spent working on those quality problems. And we have another 40% of the time spent on other wasteful activities. Salaries, $3,296 per month. 15% of that is considered overtime, but you can ignore, well, just keep that in overtime in mind. You don't have to calculate the overtime at this point. Benefits, this much per person per month. Then we have the revenue and the cost information. So supply cost per patient, drug cost per patient. We have services, we have equipment costs, we have facility costs. All right, that's the information you're going to need to do the calculations. These are what the calculations are. So I'd like you to calculate productivity, which is hours worked per patient visit. So how many, and this is over the course of a month, so how many total hours are worked in a month? Quality is defects per patient visit, average length of stay, patient satisfaction index, then average cost per patient, which is the total cost divided by patient visits. You'll see on the box score there's employee engagement. Don't worry about that. The capacity calculation, what's the percentage of productive time to total time worked? What's the percentage of non-productive time to total time? Then what's the percentage of available time? And then the value stream income statement. The capacity is pretty much there for you if you look at those percentages. All you really have to do is subtract the percentages from 100. You just have to decide which of those percentages are non-productive. You don't have to calculate the total time, okay? So there's a box score and fill in the current state. So again, divide and conquer, work together.
Yeah, I don't grab the concept of available time.
Okay, so we know that 30%, let me go back a few slides. So we start with 100%. We 30% is productive, and then 20, 40, 60 is non-productive. So 100 minus 30 minus 60 is 10. That's how we get it. Well, it's not, you see, it's not what they're not doing. It's just a factor. I mean, it's an average, okay? And we look at capacity on average. We're not looking at it as daily. But there is some, every lean operation wants some available capacity because things happen. So in any one day, you might not have enough capacity because you're seeing too many patients or because there's too much waste. So we're just looking at it on average. That's where it comes from. All right. So we're all there. Everybody.
How did you calculate the profit?
Well, some of these numbers may be off by a few digits. What? Yeah, I know. I did the calculations and I saw, I mean, we've had this exercise for a while, but right now it's too hard to change. And so I knew somebody was going to say something. Some accountant. Yeah, that's going to come into play later.
Okay, doesn't have any effect in this case on the productivity or the
No, no, it's just, no. It probably should, but for now it doesn't. Okay, we're going to keep working. At some point, lunch is coming. We're going to work till we get lunch, unless we all pass out. All right, next. Here's exercise number 2. Yeah, there's three exercises. So, there's a planned series of improvement events to eliminate waste because they want to reduce the patient waiting time. So here's what we expect to achieve. Defects are reduced by 20% from whatever number they are, 20% less, and the time spent working on defects is reduced from 20% to 15%. We're reducing the percentage of time spent on phone calls from 20 to 14%, and also the same amount of reduction on other interruptions. Because we are creating some capacity, we can reduce contract services who were actually doing some of these activities by 30%. Patient waiting time is reduced to 25 minutes. And for every 5-minute reduction in waiting time, the patient satisfaction score increases by 0.15. So, calculate the future state. Don't worry about the middle. I mean, that just shows but we have the current state. What are the future state numbers? And you can use that same box score you used on exercise 1 just to put in the future state numbers. Our productivity stays the same. We see an improvement in quality to 1.03 because we have fewer defects, same number of patient visits. Length of stay goes down to 43 minutes. Patient satisfaction goes up to about 3.6. Don't worry about employee engagement. And our capacity is now, the available capacity has changed from 10% to 29%. And we saved a little bit of money on contracted services, so our profitability went up a bit. That's the power of the box score.
And how,
Yeah.
how did you measure the employee engagement?
What, it's a given, it's just in there. Employee engagement, if you're looking at how can it be measured, there's different ways. One is like number of events per person. So it's not how many events a particular person does, but how many improvement events have been conducted in the value stream over the number of people. That's a way to gauge it. You could do participation in events, so you could track who is participating in events and do that kind of ratio. Some companies even do just problem solved per person, and all you have to do there is define what's a problem solved. If you use A3 forms sort of as the documentation for identifying problems and solving problems, you just count the A3 forms. How many A3 forms have been completed and signed off on as it's been completed. So there's different ways to do it. It's not about, this is one of those measures that some people think volume is better, just doing more events. So it's really good events. It's about solving the right problems. For example, at the hospital that we worked at, they had an employee engagement number, and I think it was the number of people over the number of events. And so this one manager I remember her measure was not doing well. She conducted an event and she put 17 people on the event to try to boost the number. A 17-person team to do an event is not good. So, with any measure, what are you trying to accomplish with that measure? And so, you know, the reason we don't have you calculate it is because there's different ways to do it. All right, so let's stop here and take a break and have some food. It's 12:45. And
30 minutes?
let's take 30 minutes for lunch, that we get back at 1:15, and then we can wrap things up by 2 o'clock. Any thoughts on doing the exercises? Helpful? And really, the exercise, we won't do the third part, but the third part is really, there's no conditions to the third part. The third part is simply, what would you do with that 29% capacity? So rather than doing the exercise and trying to calculate the numbers, what are some things you could do? You created 19% capacity. What are the opportunities? See more patients. And that would drive revenue growth.
Fire some people? Just the pros.
Yeah. Move people around. I mean, that's really what it boils down to. That's where that overtime comes in. You know, you could say, well, we keep the people, but we reduce the overtime, and, you know, how much could we take out? If you could take out 50, if you assumed you could take out 15% of the overtime, and that's 15% of the capacity, then your salaries and wages go down some. And yeah.
Does the box score help you decide where to have your Kaizens?
It could.
Decide which generates the most capacity?
Yes, you could do this looking forward. Well, and that's sort of what this is. You know, how much capacity do we want? And what type, you know, where's the waste? And how much waste do we need to remove to try to get the capacity we need? The box score is also helpful in terms of if you see you don't have enough capacity, you know, we have to add capacity. Yeah. So that's exercise 3. You know, you can do whatever you want in terms of, and it's a nice effective exercise. Again, much like I talked about visual performance measurements and the way you have people track them and do them themselves. You know, if you're trying to explain the concept of the box score and capacity to people inside your business, I mean, you could just do this exercise. And, you know, you go through the calculations and you learn a little bit more than listening to someone like me speak.